it started to hit Europe, even more so than the US and Italy, and there was this feeling in Italy, like, why didn't anybody tell us this was coming? And for us, it felt really strange to watch that from here because we'd been covering the story in and out in multiple countries, day in and day out. And there was intense interest here in Asia. Here in Bangkok, you would see people wearing masks and people, were suddenly acting very differently toward one another. And you'd see what's happening in the US, or you talk to family back in the US or Europe, and this wasn't on people's radar. It was this kind of disjointed feeling in a way, being here and then watching what was happening in other parts of the world. There wasn't, I think, a full appreciation of how serious this could get. The pandemic showed us how little we know about a lot of things, and how one event that doesn't seem significant right away can change the course of history in a lot of ways. Recovery in Asia is probably going to happen faster, at least on a broad scale, than it will in other parts of the world. In the same way that mitigation measures and efforts to counter the disease happened faster in Asia. Certainly a country like China, ironically the place where the disease first emerged, is probably in one of the strongest positions of any large country around the world in terms of the virus. People in Wuhan are going back to movie theaters, music concerts, skating rinks. So life there is largely back to normal. Places with some of the largest populations like India, like Indonesia, still have a long road to get through the virus pandemic. But I think even in those places, in some ways, they are a lot further along than other parts of the world. As a whole, Asia has weathered this pretty well. And part of that might be experience of dealing with other disease outbreaks like SARS. I think part of it is also just people very early on in much of this region took steps to keep themselves and other people in the country healthy and safe, things like wearing masks. And I think that makes a huge difference.
February 21st of last year was a Friday. And we were, of course, in the office in London, in Camden, and getting a call from our news director in Southern Europe about COVID outbreak in Northern Italy. Certainly our colleagues in Asia had been covering it for the past couple of months prior to that. But there seemed to be this sense, false sense, obviously, that there was some sort of containment to it or something, and then it would be a while before we'd see something happening to other parts of the world in the same way that was happening in Wuhan and some other places. So that moment, and it was so confusing because we didn't really understand what that meant. And I don't really know how much they understood in Italy. The authorities there knew what that meant, but they knew that it was spreading, and it was spreading between people. They couldn't relate back to like who got it, who gave it to whom. And there was an outbreak. And I think that was truly a moment where it all kind of came very realistic that this was happening. The sounding of the alarm from Italy was so loud, and you could sense the kind of panic in it. It was a moment of realization that this was here, and life sort of as we know it is changing.
In Ecuador, by April, what happened is that we started seeing reports that people were leaving bodies of their loved ones in the streets, and we hadn't seen that anywhere else. Hospitals were overwhelmed, and they were incapable of receiving people not only sick of COVID, but also suffering from any other pain. So people were terrified, and they didn't know what to do. Latin America has been considered like the most unequal region in the world. And that situation takes you to a different one, but very connected, and that's the lack of a proper infrastructure. If you combine both the elements, you have a kind of bomb, specifically in some places, in the poorest places, for example, Central America, some places in South America like Peru, Bolivia, where it's so complicated to get like the basics. So when you are in the middle of the pandemic, you need more than basics, but you don't have the capacity to do it. And I would say that there's even a third element, and this affects all over the region, and that's corruption. And corruption means that some governments or officials in some governments are trying to funnel some money, destined to some hospital, for example, to do or to another place, and that complicates even more the situation. People are desperate. People think that they need to go back to normal, but normal understood as going back to work, to keep working. So people are defying more and more the quarantines and the lockdowns because some people can afford it.
Our economy is so built upon the free and easy access with which people have to gather en masse, whether it's going to restaurants, museums, concerts, sporting events, conferences, all of these things that were now not going to happen, and realizing the impact that was going to have on a big segment of the economy and all the people that were reliant on those jobs. That's dramatic. I'm fortunate enough to be one of these workers who's sitting in my home, working still, more or less unchanged, as did some segments of society. And there were still hospital employees, delivery people out there dealing with it. And that was like the big aha about how this economic event was different from others. This hit people in different ways, in uneven ways. And so the inequality that had already been present in the economy was exacerbated. The economy won't look exactly the same when it fully reopens again. It's hard to tell in what precise ways that will be, but we know the power of Zoom. We know the power of technology more broadly to show us the ways that we can conduct commerce that are different than we had before COVID. Companies learn ways to do things differently. And so if you figure out that I can do this with fewer employees, some companies are going to do that. Or maybe there are just some aspects of the economy that don't come back as strongly. Maybe not as many people will want to pack into arenas or restaurants or planes, not forever, but for some extended period of time, even after the vaccines come back. I don't know how confident people will be. It will be something we'll just have to watch.
It was not the death knell for entertainment that I think some of us just sort of worried about, in the beginning, because if people found a way, like they say in Jurassic Park, life finds a way, like creativity finds a way, entertainment found a way, the industry found, various ways to move forward and still create and put out content. But, it was for those things, anything that requires that in-person contact, the things that make, entertainment so personal, those have been gone for a year, and we still don't know when a lot of it's going to come back. If your hometown has a community theater, it's probably struggling right now. And some folks have been able to get by, both through the government grants and also like turning to online and getting some revenue there and the kindness of donors. But that's going to all get a little bit harder the longer that this goes on. You've seen this in a number of cities, where folks have left. And if there's Broadway stars who have left, are they going to come back? How does this all sort of shake out? I think re-entry and when people are able to move around again and able to work again in a more traditional way is going to be rather interesting. There's a whole group of people who are looking at 2020 and going to have big projects and potentially star-making projects that haven't come out yet. People haven't stopped creating. So I do wonder if some of those folks may lose their moment, may lose their chance, may lose their opportunity to reach that bigger stage.
pandemic really shined a light on what we already knew, sort of that live sports at the highest level is a made for television event. And it's not the majority of revenue, it's almost all the revenue is from television. So they can go on without fans. But we haven't played minor league baseball. We haven't played many lower level college sports other than men's basketball, women's basketball, and football. We've tried to have some of that, but a lot of those events just got wiped out. I worry about the young people who have lost a year plus of development in team sports in particular. And I worry about that generation never getting that back, especially for really skill-based competitive sports like baseball and hockey, where in tennis, if you don't pick up a stick, if you don't pick up a bat for a year, the idea of getting back, it doesn't come back like that. Think about a player like Mike Piazza, who was not highly drafted and developed in the minor leagues over time. A player like that's not going to get the chance. There's no baseball for a player like that right now. There's only baseball for the guys on the major league roster and maybe another 30 to 40 guys. Not single A, not rookie ball. They're not playing. And they're not getting the chance to practice. And it's just, to me, increased the gap between pro and elite sports and you know, other athletes.
We saw how wide the economic gap was. We saw how wide the healthcare gap was. Already in many of the predominantly Latino and predominantly Black communities, and particularly ones where socioeconomically they're on the lower end or close to the lower end, there's already a wide gap in those folks in those communities having access to proper medical care. So when COVID came around, it exacerbated all of those things. You know, with Latino and Black communities, there's often multi-generational families living under the same roof, and that was something that also added to the risk factors when it came to COVID and our families and our communities. A lot of frontline workers in you know, whether it's the food industry, the delivery industry, maintenance, hospitality, cleaning industries, those are people of color in most cases, you know. And so you have a situation where you'd have Black and Latino frontline workers going to work and then coming back home to, you know, large family home environments. And so that raised the risk factor. A lot of the things that we're seeing today have occurred throughout history. I think a lot of people, either they weren't here because they're a different generation, or they just have forgotten how racism has prevailed through the years, how inequalities have prevailed through the years. And so what our team tries to do, as much as we can, is connect the dots to show people that this isn't anything new. This has been going on for years. It might just look different now, but more importantly, now that you know what it really is, what are we going to do about it?
I think what the pandemic did is it shined spotlight on his actual management of the US government. And it put a spotlight on his ability to take this sprawling apparatus and put it to use when it's needed. You know, he had benefited for the first 3 years of his presidency from an economy that was improving. He benefited from a real lack of major foreign policy crises that pulled the US in. There was not anything that, you know, required the US to send troops abroad. So in some ways, he had not really been called on to sort of step in as a leader in crisis. And he was during the pandemic. And it made people take a look at his presidency in a different light and look at him not just as a disruptor, not just as somebody who was a provocateur, somebody who was a businessman, you know, who could take a businessman's eye to the economy, to really look at it in sort of its most pure sense, the presidency, as, you know, the person who leads the country in difficult times. And if you looked at polling, you know, throughout the campaign, it really showed that that's where he took a hit, that Americans did not trust his stewardship of the pandemic. They did not trust the information that was coming from the White House. And what was so interesting about the White House's response and Trump's response is that his answer to that polling, to those reviews from Americans, was often just more Trump, to put himself more at the center of the conversation. And so ultimately, by the time we got to November, it really did feel like this was a referendum both on Trump personally and on his handling of the pandemic.
I was a little surprised that it would be so politicized. In some ways, it doesn't seem like it had to be that way. Why is this even relevant? Don't we all have the same goal here? It seemed like everyone would want to control the spread, which would help the economy and reduce the job losses, reduce the deaths. It seemed eminently logical that we would just all want to try to understand what the best science says and follow it and get out of this. Science takes a long time and is best done in carefully controlled circumstances to get the best results. And we have had neither time nor carefully controlled circumstances. So the evidence on which public health officials, government officials, and others have had to work with to try to deal with this pandemic has been terrible. Not because of any nefarious reasons, just because there hasn't been a lot of time to truly understand the biology of this bug and its behavior in the world. The two things that have been most difficult have been conveying nuance and the preliminary nature of a lot of the research that we've been writing about. And then also to help people understand risk, which is a very, very, very difficult thing. This disease on an individual basis is not nearly as severe as a lot of other communicable diseases. There are a lot worse bugs out there on an individual, personal basis, but it can be very dangerous. And on a society level, we now know it is incredibly destructive. There are major implications for society, as we saw. Hospitals overflowing, hundreds of thousands of people dying because it spreads so easily, even though it's a small chance of you dying. When you have an entire population who has never seen this bug before, everybody, as they say in public health, is naive to this. You're going to get a lot of infections and you're going to get a lot of death, not by percentage, but by raw numbers, and that can overwhelm the system.